the incredible story of a Quad City woman who is truly beating the odds. This is Melanie Putnam, and 13 years ago, she had to undergo an incredibly risky double lung transplant at the University of Iowa. Most people who get this surgery are not alive 10 years later, but Melanie is. In fact, she's joining us right here on The Current, coming up in our second half hour. But before that, I want to introduce you to the team that helped save Melanie's life. So we sat down with Dr. Julia Klesney-Tate, Medical Director of the Lung Transplant Program at University of Iowa Healthcare.
We are so honored to be joined by Dr. Julia Klesney-Tate. Thank you so much for making time for us.
Oh, it's my pleasure.
Why don't you start off by introducing your job and what you do when it comes to lung transplants?
Okay, well, I'm the medical director of the lung transplant program here at the university. And what the job entails is taking care of patients that have end-stage lung disease and making that difficult decision about when it's time for them to go to transplant.
I think people don't realize how low some of these survival rates are. Talk to me about what the survival rate is for a lung transplant patient 5 years post-op.
So currently, 5-year survivals for lung transplant are somewhere around 58 or 60%. Lung is a very difficult organ to protect from the environment and from infections. And all patients that have transplantation require immunosuppression. So it's a very, very difficult patient population.
I can only imagine. So let's talk about something that's even more difficult in that realm. Tell me what LAM is.
So it's a mouthful. It's leiomyomatosis, and we all call it LAM for short because it's such a huge name. But what it essentially is a disease that, for the most part, affects young women. The average age of onset is in the 30s, so really getting women at the prime of their life. And what we find is that these patients develop smooth muscle like cells that can attack different parts of the body. And in the case of lung transplantation, for the patients that have significant lung disease, they get cysts in their lungs, and these cysts go on to rupture. And when they rupture, it makes it very difficult for the patient to breathe.
And I can also imagine that this is not something that a lot of doctors or pulmonologists have experience with if it's so rare.
No, you're absolutely right. It would not be uncommon for a doctor to have never seen a case of LAM in their career. It's a very rare disease. So Melanie was very fortunate that she came to the University of Iowa, where her disease was quickly recommended.
Our viewers, we live 45 minutes, an hour away in the Quad Cities, but even throughout our viewing area, we're drivable to the University of Iowa. People know that the university is known for its healthcare and its cutting edge healthcare, but what makes your pulmonology team so special?
Well, so I think that what makes it special is that we have physicians that have expertise in all different kinds of rare diseases, and I, as a transplant pulmonologist, work closely with the rare disease physicians so that we're in constant communication about patients who are at risk to require lung transplant. So again, in Melanie's case, when the situation was grave, they contacted my team immediately, and we came to evaluate her.
How rare is it that Melanie is alive and doing so well 13 years after the fact?
So she has the special sauce. The 10-year survival for lung transplant is around 25%. And so most patients that we transplant are not going to see a 13-year anniversary. So it's really spectacular for our team to be part of taking care of Melanie and see her do so well.
Julia, before I let you go, I want to go back to organ transplants and organ donations. I mean,
Yes.
earlier, I was actually just at the DMV this morning and had to check off that box.
Fantastic. Everyone should check the box.
That's what I was going to ask you about is what is your message for people when it comes to the idea of organ donation?
I think the message is sign your driver's license, because there are over 100,000 people waiting for transplant, and 17 people die every day. And so if people take the time when they're just at the DMV to sign it, then their families know what they want if there is a tragedy, and there's something good that can come out of that tragedy.
Especially when you got a team like yours. Julia, thank you so much
Yes,
for
absolutely.
thank you so much for your time today.
Anytime. I appreciate the opportunity to talk about transplantation.
Yeah, we hear it all the time, how important organ donation is, and make sure you stick around because Melanie herself is joining us right here in studio in our second half hour. Hear her message on defying every odd coming up in about Julia Klesney-Tate, Medical Director of the Lung Transplant Program at University of Iowa Healthcare. Here's what she had to say about the survival rate of lung transplant patients.
The 10-year survival for lung transplant is around 25%.
This is why Melanie Putnam's story is just so remarkable. She is a Milan woman, but around 16 years ago, she was diagnosed with something known as LAM. This is an extremely rare lung disease that impacts women. It was essentially putting holes in her lungs while she was pregnant. Now, Melanie met with the team at University of Iowa Healthcare, and 13 years ago, she underwent a double lung transplant. And today, she is beating those odds that we just heard from. She's alive and well, raising her kids right here in the Quad Cities. And she joins us right here today on The Current. Melanie, thank you so much for being here with us.
Thank you for having me.
Why don't you take me back to that time in the hospital? You were telling me earlier you guys spent weeks living at the hospital in Iowa City. What was that like?
Well, it was really scary, obviously. I had been sick for so long and stayed home with my kids, couldn't leave the house very much and things like that. So I was airlifted there because my lungs had collapsed and I had had a seizure. So it was basically just a matter of just knowing that I was waiting for something. I knew that there was something that was going to happen that could potentially save my life because I was basically just dying at home and I knew that.
So something did come along. You find out that a set of lungs was freed up. I mean, what was going through your mind?
So we had actually had multiple what we call dry runs, which means they tell you there's lungs available, but then they ended up not working out. I think I had 2 or 3 of those. And so to finally know that, this time they said that there was lungs, and I wasn't as excited as I thought I would be at the time, but I was just trying to relax and, things like that. And it just worked out, and it just felt very peaceful. And obviously it worked out very well. So.
Do you still keep in contact with the team at University of Iowa Healthcare?
Oh yeah, so I go every 6 months. Every month I get blood work and pulmonary function tests and things like that. If I'm ever sick or there's ever anything that is potentially wrong with me, they immediately are on it. So they honestly feel a lot like a family. We're very close and all that, so.
This seems like a very obvious question.
Yeah.
So besides the medical aspect of this, how has this whole journey changed your life and your family's life?
Yeah, so before all of this, I was a working mom, very focused on my career. And I always say that as much as obviously you don't want something bad like this to happen. And I'm on borrowed time and I know that, and I'm not gonna live forever, so all that stuff is bad. But I never would have the appreciation for life that I do right now if this hadn't happened, if that makes sense. So it's like I truly live every day like it's my last, and it could be, and I don't know how long I'm going to live, and I hope much longer, but as Julia Klesney-Tate said, I'm definitely on borrowed time, and I don't know how long I'm going to live, but it just gives me like an appreciation for life. Like every day when I wake up, I feel like happy and excited, and it's just, life is just different. When you go through what I have gone through, life is different. You definitely appreciate things more than the average person. And I never would have had that if I didn't go through what I've gone through.
What does that look like to you? I know you're very active in your kids' life and going to their sporting events. Are you also big into volunteering?
Oh yeah, so my husband and I do a lot of different community things. We've run a couple of organizations. We do all kinds of stuff. I never miss a game of my kids. I always have the camera. I take videos of everything. I'm definitely that mom. I just try to appreciate and be a part of everything that I can be, because you never know what's going to happen. So
we talked about it in our first half hour, but I want to hear from you. What is your message when it comes to organ donation?
Oh my gosh, it's so important. You can't take them with you, right? So I know when I was waiting for my lungs, it's so stressful because you can wait forever, and a lot of people die. I don't remember the statistics that Julia gave, but you can't take them with you. It's so important. The gift that I feel that I received by receiving the lungs of the person is just, there's no words that I can describe. I just feel so grateful every day that I have this second chance, and it's because some family was very generous and willing to give me their organs. And now I get to be with my family. So I'm so grateful, and it's so important to donate your organs if you're able to.
Melanie, I told you I was a crier. I told you I was
Kleenex is over there.
teary-eyed. Before I let you go, You are something of an expert of living your life now to the fullest.
Absolutely.
What's your tips for people watching at home, especially, as we enter the holidays and New Year's?
Yeah. So just make all the memories you can make. I try to make memories out of everything. I try to go to everything I can go to. I take pictures of everything and just make things as special as possible. Keep up with your kids and your family, and just nobody is promised tomorrow. Obviously for me, but everybody, you never know what could happen tomorrow, and just appreciate what you have today. That's the best thing I can say.
Melanie, I can't thank you enough for coming in today.
You're so welcome.
Giving us your time. Thank you so much.
You're welcome. Thank you.
For you guys at home, if you want to share Melanie's story or check out her blog, she's been writing about her journey, you can find our online article underneath our As Seen on TV